Hello and welcome to HEAL. This is health, equity, and advocacy learning for Black people. And we've put this course together because health equity for Black people is the urgent health issue of our time. And we're going to be sharing stories and statistics. And this course is designed both for the patients and public and for health professionals to learn about health equity issues in the Black community. So come with us on the journey. The first story I'm going to share with you is the story of Amina. Now, Amina is a young woman in a remote African village. She's got limited access to healthcare resources and trained professionals, and she faces delays getting to the hospital with limited transportation options. When she finally gets there, the hospital is overwhelmed, and then that leads to prolonged waiting times. And then it's discovered that Amina needs surgery, and then there's a whole rush to try and get the financials together, but that's unfortunately too late. And Amina then develops complications of a ruptured uterus, and then she's severely bleeding and unfortunately loses the twins and also her future fertility. And the lack of proper care means that she's resulting into having something called a vesico-vaginal fistula, and that's when a tract forms between the bladder and the vagina, which means she's constantly leaking urine, and that causes even more physical distress, and that leads to social isolation and impacts on her even further. Amina's story highlights the urgent need for accessible maternal health care and the detrimental impact of limited resources on women's well-being in Africa. But Amina's story is a woman that I've actually seen whilst I was doing my work placement all those years ago as a medical student. It's a common story, very sadly. But even here in the West, we see similar outcomes, rarer, but still happening with Black women. Now, let me take you to another story, and that's a story of Jamal. Jamal is a young Jamaican American who's moved to a bustling city in the United States, striving for a new life. But what does he find? He finds struggles with cultural adjustment. He finds himself socially isolated, living with a distant relative, perhaps not getting along so well. And then he develops depression and anxiety. And then there's cultural stigma around that mental health problem, which is a barrier for him seeking the help that he needs. He's juggling 2 jobs, a construction worker by day and a night cleaner, something that's very common for immigrants, as he aims to put the money together advance his education. He then starts getting headaches, which is caused by hypertension. And he doesn't know this, but this is something that is common, where hypertension is more common in the Black community, or early onset hypertension. And these headaches are impacting his well-being. So Jamal puts the money together to get the medical help. He gets to the clinic, and then there's difficulty. Doctor and himself have communication challenges because of his accent, and that demoralizes even further. And then he's afraid of what a mental health diagnosis can do to his family reputation, and that adds to his emotional anguish. Jamal's story could be an African or Caribbean immigrant to the United Kingdom, and it underscores the need to break down cultural barriers and stigma surrounding mental health, particularly when people move to a different country, or from the generational and heritage trauma that Black people often have. Accessible and open discussions are crucial for people like Jamal to seek the help they need and achieve well-being. So, why have we created this course? It's because education is a key component. So there are many social reasons as structural racism and things that can't contribute to the health inequities suffered by Black people. Many of these things we are working to eradicate or improve. But one of the things that would be very easy to fix compared to some of the more systemic issues is education, because education and literacy can fundamentally revolutionize the African and Black diaspora healthcare challenges. It dispels myths. it empowers communities, and it enhances health outcomes. And it will have a massive positive effect on African and the Black diaspora's health outcomes. Statistics and knowing the data also highlights the disparities in healthcare outcomes for Black individuals globally. And that's what we're trying to showcase on this course. So I'm going to take you through some statistics. Life expectancy in some African countries is significantly lower than the global average. In fact, in sub-Saharan Africa, the life expectancy is 57. So I just want you to take a moment and just take that in. 57. That's compared to a global average of 72. It's shocking. There are such high infant mortality rates, up to 70 deaths per live birth, per 1,000 live births in sub-Saharan Africa. These figures are mind-blowing. People are dying younger and unnecessarily because of health inequity. And that's why this is the urgent health issue of our time. Now, we see these things in Africa, but we also see it in the United States. Black Americans have a lower life expectancy compared to white Americans. There's a 3.5-year difference between these two populations. We also have a very high infant mortality rate for Black children compared to white children in America, which is shocking. In the UK, we see similar. Again, there's a 3-year difference in life expectancy between Black people and white people in the UK. And there's this shocking statistics for Black women who are 4 times more likely to die during pregnancy or childbirth compared to white women. But it's not just in Africa, the US, and the UK. The African diaspora is wide, and it includes South America, Canada, Europe, and even parts of Asia, the Australias, and South America. So these are wide-ranging disparities across all diaspora communities. And we see in the Caribbean higher rates of chronic disease amongst Black individuals compared to the other populations, with prevalence of diseases like diabetes, hypertension, and heart disease nearly double the general population. And we see this also in Africa as we start to see some of these diseases begin to be more common as well. Now, in South America, the Brazilian Black population has higher maternal and infant mortality rates. And again, the life expectancy is lower. We see healthcare discrimination in countries like France and the Netherlands, and Black individuals experiencing disparities in their care with elevated rates of mental health conditions. And this is particularly rampant amongst the immigrant population. And these issues are worsened by the isolation and the lack of integration that some of these Black people feel. So in this course, we're going to be going through certain modules. We obviously can't cover the breadth of all the different health conditions in which there are inequities, but we've targeted these areas to really highlight and showcase some of the ones that are most dramatic. And we're going to start off with heart disease, diabetes, and stroke, also hypertension, which underpins some of the biggest disparities in health equity outcomes. We look at the impact of systemic racism on heart disease, on hypertension, and stress as well. Systemic stress and inherited stress and generational stress on poorer health outcomes in Black people. We also recognize the importance of lifestyle modifications, the things like diet and exercise and weight management to help the community. And this will be looked at in depth in that module. In the next module, we look at mental health. Now, we raise awareness about mental health stigma in our Black communities, and we look at signs, symptoms, and treatment options for a variety of mental health conditions. And we also look at promoting self-care strategies and coping mechanisms, and really try and give an overview. Next, we move on to women's health. We look at infertility, PCOS, endometriosis, fibroids, perimenopause, and menopause, and talk about how Black women are more affected by these conditions and how we can really go about helping Black women achieve better outcomes. Then in the next module, we look at cancer risk in Black people. So Black people are more likely to die from breast cancer and prostate cancer, and also more likely to have earlier onset of these cancers. We're also more likely to have more aggressive colon cancers. So we look at why that is. We look at some of the genetic issues. We raise awareness about the cancer risk factors, but we also talk about promoting cancer prevention strategies and screening. Next, we go into skin health. We talk about eczema, seborrheic acne, and skin cancer. We also look at the impact of environmental factors. And then we talk about some of the dermatological conditions, how to care for the skin with those conditions, and regular skin cancer screening. We're then also going to do a deep dive into skin and hair care for Black people in a sidebar module on the course. Then in module 6, we're going to look at muscular and joint health. So we're going to look at the impact of arthritis and autoimmune disease in the Black community, and the core line that runs through it of chronic stress and how we look after our bodies. We're going to discuss about vitamin D and its role in bone and muscle health. We're going to understand the specific challenges faced by Black people in accessing proper diagnosis and treatment. And we're going to talk about self-care strategies. In module 7, we're going to look at men's health. We're going to address the unique health challenges to look at things like enlarged prostate, condition known as benign prostatic hyperplasia, which is very common in the Black male community. We're going to talk about erectile dysfunction and treatment options. We're also going to talk about men's mental health and the barriers that Black men face in accessing the help that they need, and also the systemic racism that impacts that as well. And in module 8, we're going to be talking about maternal, perinatal, and child health. So we're going to be talking about the challenges faced by pregnant women and by Black infants. And we're also going to be talking about the differences in African and Black diaspora in these issues. We're going to look at some of the conditions that are common in childhood, such as sickle cell disease that affect the Black community. We're going to talk about things like asthma, allergies, but we're also going to investigate vaccine hesitancy in the Black community and really talk about why that is the case, and see if we can talk about how to address that. So that's what we're going to be talking about. And really, again, just to conclude, this is all about education, because education is vital. It is vital, and it will raise awareness and urgency and mobilize us and empower us to do preventative care, because as the adage says, prevention is better than cure. So it will really enable us to have preventative measures in place and have a holistic approach for early diagnosis, community support as a community of Black people, and also to start to address some of these other social determinants. And it will help unify our efforts. So as I conclude, what I will say is, please enjoy the course, spread and share within your networks. We're doing this to make sure that we raise that awareness of health equity as the urgent health issue of our time in the Black community, because Black lives do matter, and that's why we are doing this course. So I hope you enjoy the rest of the course, and please send us feedback and let us know how we can improve. And my name is Dr. Itunuoluwa Johnson-Sogbetun. It's been wonderful having this conversation with you. Thank you very much.